Hi, my name is Dr. Jeremy Heidt, and I'm a chiropractor and owner at Midwest Chiropractic and Wellness in Eden Prairie, Minnesota. I wanted to answer the question today that we get a lot is what do we do for treating acute and severe lower back pain? A lot of times patients, when they come into our office, they're rating their pain from a 7 to 10 out of 10 pain, even a 12 out of 10 pain. These patients are very inflamed, they're having a tough time moving. And one thing that they mention a lot is they just don't want anything, obviously, to make this pain worse at all. So this treatment that I'm going to show you, it is definitely a very effective treatment, but it's very tolerable and patients do really well with it. When we see patients that are having severe back pain like this, we have two goals. Number one, we want to help you get out of pain as quickly as we possibly can. And number two, we also want to decrease the chance of reoccurrence or this injury coming back in the future. So I'm going to show you this treatment today. We have a lot of different treatment and techniques at our disposal. This is just one of the most effective and, once again, most tolerable treatments. So I have my patient on the table right here. And what we're going to do is nice and easily, we're just going to drop that table down right here. And then we're going to get right in here. And this table is just going to move just nice and gently forward and back here. You doing okay with that? Okay. And typically patients kind of tell us when we're treating them like this, especially when they're in those high pain levels, that just feels good. It's just taking pressure off of their spine and really kind of flushing that inflammation out. So we're going to go 3 sets of this right here. And I actually have my fingers on the spine so I can actually just feel those joints moving and opening up. And we have kind of a couple things that we want to see with that. We want to flush that inflammation out of there, which is causing the pain. And then we also want to get some good nutrients into the spine here. So we're going to go through that one more time here. You still doing okay with that? Okay. Just a nice and gentle treatment, especially in those high pain levels. Patients tend to do really well with this. Okay. Nice break right here. And then we might do a little bit of kind of acupressure points in here, just kind of going down the spine. Sometimes if patients are getting the sciatica down into the leg, we'll kind of work into that leg right there. And we'll go into this once again right here. Just nice and gentle. And I'm just feeling the spine just opening up right there. So the other thing that we can add here is if the patients can tolerate it, we can adjust them on their side. Some patients can tolerate it, some patients it's just way too much for them, but that is one thing that can definitely help. The other thing that we're going to put on patients when they're in pain, we have an electric stim unit, so we're going to just take 2 pads and we're going to place those on the back at whatever level that is causing pain. These electric stim, basically they help decrease any muscle spasms. They also help increase the range of motion so we get patients moving. And then we're also going to get patients on a home exercise plan. So a lot of times they can't do a whole lot in the beginning, but we need to get patients moving. We need to get them on their feet, get in some motion in their spine. So every single patient that comes into our office, we're going to get them on some exercises, and then we're going to kind of progress those exercises as they start to get better here. So this is just one of our types of treatments. It is very effective. Patients do really well with it. Typically, when we see patients that are having high pain levels, if we treat them right and they kind of follow our recommendations outside the office, we get to do our work in here. Each time we get to work on them, we're starting to see that results and get them feeling better. And a lot of times, by the end of 2 weeks, we are seeing patients 75 to 80, 90% better. Typically at the end of 2 weeks, we want to see them 50% better. So my name is Jeremy Heidt, and I am at Midwest Chiropractic and Wellness. If you have any questions, that's what we're here for. We would love to have any of those answers or any contact. Go ahead and reach out for us, and we'd be glad to help. Thank you.